welcome to SVG TV News for Thursday, September 1st, 2022. I am Yvette Boynes with the details. We begin news tonight with a developing story. Police have confirmed that a body of a male was found in Georgetown earlier today. SVG TV News understands that the body belongs to a farm worker who went missing 3 days ago and has already started to decompose. Police tell SVG TV News that the cause of death is at this time unknown. The identity of the deceased is yet to be confirmed. Government has officially handed over 27 houses to North Windward families who were affected by the eruption of Lassafra last year. The ceremony was held this afternoon in Orange Hill, attended by senior government officials, representatives of the construction team, and the recipients of the houses. Deputy Director of the National Emergency Management Organization, NEMO, Kenson Stoddard, says the eruption and the passage of Hurricane Elsa put tremendous strain on SVG's disaster management agencies. Stoddard thanked the families for exercising patience during the time that they were displaced from their home.
The events led to the displacement of several families who have displayed tremendous levels of patience and resilience as they continue their lives, navigating challenging circumstances, making the best of accommodation in private homes, rented apartments, and other public and private buildings. Most of these families and persons were thrust into unfamiliar surroundings. Today represents a moment of despair, as 27 families will be presented with the keys to their new homes here in Orange Hill. I want to personally say thank you to the members of the 27 families for their long suffering and incredible mental fortitude. I know the last 16 months may have been uncomfortable and at times frustrated, but I hope these gifts today will produce a smile radiant enough to eliminate the dark tunnel of your recent past.
The initial construction phase for the houses was carried out by a non-profit organization, Sri Satya Sai Baba, out of Trinidad and Tobago. In his remarks at the handing over ceremony, Representative Dalvi Paladi says the organization has traveled around the Caribbean constructing houses for persons in need.
Almost in our country, Trinidad and Tobago, we do one of these houses for a needy family at no cost to them. The houses are fully furnished and we try to stay anonymous. Today, it seems that anonymity may be lost. We would have had to do some pre-work and then the main group would have come in and we knew that we would erect the structures with the pre-work in 3 days. Amazingly, within 24 hours, we had 60 volunteers from our group who volunteered to give up 2 weeks of their time to come here and serve people who they don't know and who they will never know. It's not a long time. These houses are hurricane resistant up to category 4. These houses cannot burn. These houses are termite resistant. These houses, if the families who get in the houses today keep love as the basis for their lives from today, these houses will last forever.
Numerous challenges delayed the construction of the Orange Hill development over the last year. Word of this came from Minister of National Mobilization and Housing, Orandi Brewster, who delivered remarks at the handing over ceremony. Minister Brewster says the COVID-19 pandemic affected the movement of people and building materials for the housing development, adding the ministry had to collaborate with a number of entities to complete the project.
The initial work on this site was done during the time of COVID-19, which was expressed by Mr. Paladi of the Sai Baba group. And there were many restrictions for travel. And through networking and connections, we contacted with this group out of Trinidad and Tobago. And at the pin's drop, they were ready to get here to St. Vincent to help us and to help the folks in North Windward to put a roof over their head.
Minister Brewster adds persons from the diaspora came forward to assist with the outfitting and furnishing of the new houses.
reach out to folks in the diaspora to get help with some of the items to be placed in these homes. And there's a group out of New York which were only established in that year of February. And I say the good Lord moves in mysterious ways, you know. They were established in February and we had the eruption in April. And when we reached out to them and asked them how they can partner with us, they said we will do as much as we can. This is the SVG Relief USA Inc. And they're represented here today by two persons, Mr. Ainsley Primus and Nolly Wilkins. The others from the group, they donated 27 brand new refrigerators. So every home here will be outfitted with a brand new refrigerator. And they were all purchased here locally. And apart from that, this group, and I must give them their kudos today, they shipped down during our time during our challenging time, 2 40-foot containers with different items, hygiene kits, generators, all sort of things that would benefit us here in St. Vincent and the Grenadines.
The Ministry of Education has signaled its intention to expand the number of early childhood institutions across the island. This disclosure comes from Permanent Secretary in the Ministry, Mickelberg, who made an appearance on the VC3 Roundtable Talk program on Wednesday evening. During the interview, it was noted that the Early Childhood Education Department in the ministry is only staffed with 2 persons, and the goal is to establish a full-fledged unit. P.S. Burke says there are currently 15 early childhood centers run by government, and the ministry has secured grant funding through the Global Partnership in Education to train additional teachers and step up additional.
Early childhood is getting a great focus at this time because we recognize that the formative years is a determinant of a child's output and a child's development. And with BNTF as well too, we are looking to do some work at a school in Fitzhugh where we are doing some reconstruction, some refurbishing and some extension of the school to accommodate all the childhood education. Currently we have about 15 or so all the childhood centers that are government operated, and that has been expanding. Last year we saw the introduction of an early childhood center in Richland Park. We saw one in Bayabu as well too, and there are others that we have introduced as early childhood continues to get the focus and attention it deserves.
Meanwhile, Education Minister Curtis King says the ministry has recognized the need for an expansion of tertiary education opportunities and training in St. Vincent and the Grenadines. His comments were made on the heels of a move to assign tertiary education into a separate ministry. The new ministry is being led by Prime Minister Dr. Ralph Gonsalves.
We are at a state now where we are basically seeking to align our education system, the goals and so on, with our developmental goals, our strategies. The data from whatever source you get, whatever country, will show that countries who have exposed their citizens in greater numbers to higher education and training are in fact those societies that are doing better in today's world. As a small developing country, we too have come to recognize that if we are going to achieve the developmental targets that we are setting, if we are going to enhance, if you like, our economy, if we are going to build the sort of society that we want to build, then we have to expose more and more people to higher education and training.
The Education Minister continues to give the assurance that the opening of schools will not be delayed, even in light of construction and staffing challenges. The issue of staffing has been affecting the ministry since the dismissal of unvaccinated teachers from service last year. According to ministry, a staffing exercise has commenced and persons have been identified to fill the vacancies. Minister King explains the ministry has had to push back the deadline repeatedly to allow dismissed teachers to reapply.
I think we should be fair and say that this year we are a bit late because, I mean, persons would know of the situation in the country where some of our teachers who didn't meet the requirement for number 28 of 21. We were hoping that teachers would have reapplied and hence fill some of these vacancies. The government itself took a decision to facilitate those teachers who wanted to return, and as such the ministry had to, if you like, wait, because we repeatedly extended the deadline for persons to apply for the various vacancies, and hence the last date identifies deadline was August 23rd. Yes, just last week. And I mean, you're talking about the filling of about 200 or so vacancies.
During the interview, Minister King disclosed that the opening of the St. Vincent Grammar School will be delayed by 1 week to start on September 12th. New group medical health plans were rolled out today for persons within the St. Vincent and the Grenadines Hotel and Tourism Association. The medical insurance plans, which were launched today, were rolled out by the Lynch Caribbean Brokers. President of the Hotel Association, Kim Halbich, said that she sees this initiative as necessary and beneficial and a way to make more persons join the industry.
That it is not an industry that is, it's a hard industry. People have to work hard, long hours on their feet. When everybody else is relaxing, we're working, and it's also going to give an added benefit to encourage persons to come into the industry because there's added benefits. I see it as an opportunity for people to get the special care they may need, whether it be physiotherapy or special foot doctor, or so it is timely, it is important, and I think we're really proud at the SVG Hotel and Tourism Association to have it in place to offer the best, without a doubt, best group health plan there is on the market today, and I look forward to massive support and continued hard work together as we help this to grow and to support our industry.
Managing Director of Lynch Caribbean Brokers, Damian Bowen, outlined the 3 different tiers of the group medical plan.
The plan has 3 beautiful tiers. The first tier, you start down to earth. That's the cost-effective tier. That's the tier for those who are budget conscious and want a plan that has teeth but can still meet the needs of the pocket, especially in this inflationary climate that we find ourselves in globally. After that, there's the Sky tier, a beautiful $1 million plan. Very competitive in the market, would not be possible without Sagicor, so I want to salute you again. And then there's the Sun limit, which is the upper limit, another $1 million tier with Sagicor, and that's for the bosses and the big boys, or those who want to really aim for that benefit maximization. If you're looking at that, if that's your objective, Sun is the target for you. Basically, with these tiers, members will have the option to pick maybe 2 tiers, one for their staff, that may be cost effective, and then you may want to select one for your management. Who knows? The protection, it gives you major medical maximum, preventative care, maternity, inpatient, outpatient services, doctor and specialist services, emergency treatment, ground and emergency air ambulance.
Hotel workers, restaurant workers, taxi operators, and other tourism workers can now comfortably retire knowing that they will benefit from the new group medical plan that is being rolled out by the St. Vincent and the Grenadines Hotel and Tourism Association. Speaking at the launch, Minister of Tourism Carlos James applauded the stakeholders who made the initiative a reality.
Very often, you will have persons who would spend years working at bars and restaurants and operating a taxi service or utilizing their services to do marine tours or even a tour operator. And they go home, sometimes they're self-employed, and they go into retirement. And sometimes they may not even contribute sufficiently to the National Insurance Service Fund. And what they received in their pension, in terms of the contribution and the returns, is not even sufficient to support them and their families. Very often, in instances where persons are injured while executing their jobs, or in instances where they succumb to medical conditions and life-threatening conditions, there's no provision in terms of security. And I think that this particular move is an important one because it protects both life coverage and medical coverage for stakeholders within the tourism industry.
The tourism minister is encouraging all tourism personnel to take advantage of the opportunity.
Are only as strong as your weakest link. So I'm encouraging the tour operators, the informal operators who may casually operate, to get yourselves together into a grouping and organize yourselves, because the first step is to ensure that you protect your life, protect your health, be a part of this coverage, to sign up to ensure that you receive the benefits that are now available to you. And of course, there are other things that you can lobby, and you can work collectively with the ministry to ensure that we provide the resources and the support to you as a collective.